Dr. Amalokanathan sir, Dr. Shivaraman sir, and all the faculties, students, district officials. முதல்ல உங்களுக்கு ஒரு நன்றி. பிளானிங் கமிஷனில் டாக்டர் சிவராமன் இனிஷியேட்டிவ் எடுத்து எல்லா குரூப்பையும், சரி, இன்ஃபேக்ட் ரைட் ஃப்ரம் த ஸ்டூடெண்ட்ஸ், ஃபேக்கல்ட்டி, சீனியர் ஃபெசிலிட்டிஸ் எல்லாரும் அழைச்சிட்டு வந்திருக்கீங்க. இட்ஸ் a very good initiative. See, personally, why being an allopathy practitioner, why I am interested in Siddha, see, நாங்கள் படிக்கும்போது when we define health, we'll say it's not only a absence of your, we call it physical, mental, social well-being, not only a mere absence of a disease. So you need to take a socially and productive life. In the definition fit panna, you need to have a holistic approach. See, the holistic approach is available in Siddha. So the end-to-end approach, right from your prevention, promotion of health, then how to pick up cases earlier, then how to manage your long-term, how to detoxify. See, the ellame a holistic approach, it is there. In fact, it fits into the definition which we practice in the allopathic system. So we feel more, in fact personally I feel I'm more attracted towards this Siddha system. Second time pathina, the problem which we right now face, which our Sivaraman sir face more sonare, your low weight or obesity or your whatever you less for your age, weight for your age, idella paakumbodhu ultimately this is your lifestyle, the way we live, the way what we eat, and how you practice our physical activity, how we keep our mental health free. So idanoda interactions da ultimately result in this. So in the interactions ultimately lead பண்றது the food we eat. உணவே வந்து நீங்க அடிக்கடி சொல்லிட்டு இருப்பீங்க, அந்த ஃபுட்டை எடுத்துட்டு போகும்போது சரியா முறையில் பண்ணலன்னும் போது தான் ஒவ்வொரு சேலஞ்சஸ் தான் வருது. அண்ட் அந்த சேலஞ்சஸை டாக்குமெண்ட் பண்றது தான் இட்ஸ் a big problem. So in fact recently obesity 25% of the population, another 20% is undernutrition. So almost 50% of our people தான் நார்மலா இருக்கும். So remaining either we are in the other end or this end. And in fact now there is a call even from the Prime Minister's office to take care of it. So இது பண்ணனும்னா the only way is that lifestyle modification. And the lifestyle modification வந்து எல்லா லெவலிலும் நடக்கணும். And this is where Shivaraman sir big goal, we should start from the child. ஏன்னா இதுதான் அடுத்து adolescence ஆக போறோம், adult, geriatric, இந்த ஒவ்வொரு ஏஜ் குரூப்லயும் there is a problem. See, unless otherwise we start intervening at the earlier age, things cannot be handled. அதுக்கு இப்போ சார் சொல்லிட்டு இருக்கும்போது சொன்னாரு the ultra processed food. So in fact there is ultra processed food which is high in trans fat, sugar and salt. It's ultimately responsible for all your problems. See, இதுல என்னோட view என்னன்னா, see now because of the convenience, this convenience food or the fast food has become a norm. Whether we like it or not, weekend, month end, pasanga, it has become a norm. See, now where we need to do is that how we can give this healthy food in the way they like. See, pasanga cornflake தான் சாப்பிட்றாங்கன்னா, why can't we provide an high fiber nutritional cornflake? It's all possible. The similar way pasanga biscuit தான் சாப்பிட்றாங்கன்னா, let us try how we can go for an high fiber, less salt, less trans fat. See, this is where your technology and the real science will be able to do it. இதெல்லாம் பண்ண ஆரம்பிச்சோம்னா அடுத்த generation definitely will follow it. ஏன்னா please understand, the health cannot be restored with 1 or 2 days of medication. See, it should be on a daily basis, on a continuous basis. இது வரணும்னா it should be part of our culture. See, இந்த culture வரணும்னா we need to go in the way the younger generations want. Otherwise it will be a big challenge. Now with your mobile addiction, sedentary life, the rate at which the obesity is increasing is enormous. And the rate at which the problems are occurring, it has become very quicker. Idella pannana, this is the only way that we need to fit this health program into the system, into the individual. It should be the way of living. This is what your Siddha says. So இது எப்படி நீ கொண்டு வரணும்னா ஒன்று பண்ணணும். And it's not only the non-communicable disease, even infectious disease, which we call as a communicable disease, Siddha has got a big role. In fact, சார்வா சொல்லிட்டு இருந்தாங்க, நிலவேம்பு குடிநீரும் சரி, உங்களை கபசுர குடிநீரும் சரி, it has made a big role when we had an major epidemic of dengue in 2012 and 17. It was one of the major intervention at the time. Sir சொன்ன மாதிரி RCT எல்லாம் பண்ணோம், but our expectations, we need to go a little more deeper. அது அந்த நிலவேம்பு குடிநீர் or உபசர குடிநீர், it's a combination of many ingredients. See, we need to go for the molecule. See, unless அந்த molecule போலன்னா ஒரு ஸ்டேஜுக்கு அப்புறம் by experience இப்போ சார் சொன்ன மாதிரி டிரான்ஸ்மிட் ஆகும்போது the critical ingredient could have been lost. So அதனால ஒரு ஸ்டேஜில் இது யூஸ்லெஸ்ன்னு சொல்ற நிலைமை வரும். So we need to research the younger generation to go for a real molecule identification. இது பண்ண முடியும், நம்ம பண்ண மாட்டேங்கிறோம். In fact, today we had an article in Hindu, நிறைய பேர் பார்த்துருப்பீங்கன்னு நினைக்கிறேன். See, long back in 17th century, 18th century, British sanitary, at the time they called the sanitary commissioners, they documented, which is there in London Museum, Natural Museum, more than 300 natural ingredients which used to be a protective one at that time. He has documented, but in the documentation somehow we are not doing it. In fact, I rendu try panna. Personally, I had an experience. One is on MCH, one is on hypertension. So MCH, when I was in the health office in Vellore long back, aim mothers sir சொல்ற மாதிரி tons of iron கொடுத்துட்டு இருக்கோம். But the big problem which they face is the tolerance. சரி, ஒன்று பிளாக்கா ஸ்டூல் போகுதுன்றதால பாதி பேர் விட்டுடுவாங்க, இன்னொன்று அந்த வயிறு எரிச்சல் வர்றதால பாதி பேர் they will stop doing it. See, the tolerance, when we given your Siddha Medicine, the tolerance is very good. See, the level at which the hemoglobin raises may not be a big difference, but the tolerance is there so that the continuous infuse பண்றதுக்கு ஈஸியா இருக்கு and the final sustainable level இது பண்ண முடியுது. So this I personally had an experience. I have done this RCT. RCT is needed. See, நம்மளோட empirical way of by experience இதெல்லாம் நான் இவ்வளவு பேருக்கு கொடுத்துட்டேன் நல்லா ஆச்சுன்றதை விட we should document it by an RCT. It is done. The recently your non-communicable disease is there, along with Selva Kumar is there. We could able to do one hypertension control trial. The initial results are really good. It has got a huge impact. But நம்ம என்ன பண்ணணும்னா, this is my personal view, we should not see these medicines as an competing to each other. Let's see how we can complement each other, how we can collaborate each other. See, நம்மளை பொறுத்த வரைக்கும் we need to treat the individual as an individual. We need to fit into them. So அதனால நான் இங்கிலீஷ் மெடிசன் சாப்பிட்றேன், தமிழ் மெடிசன் சாப்பிட்றேன் இல்லாம which is more suitable to you, how we can prescribe together. தயவுசெய்து நீங்க கிராஸ் பத்தி இந்த சிஸ்டம் அந்த சிஸ்டம் பிராக்டிஸ் பண்ண வேண்டாம். See, everyone has got a role. How we can put together, work together, complement each other and support the human being is the big one which we can do it. In fact, I remember you are running a COVID center. Exclusive COVID center. So when we had thousands of COVID center, there's an exclusive Siddha Medicine driven COVID center which has got a equally good results. But initially, எல்லாருமே hesitate பண்ணாங்க. When we are requested to start, initially there was hesitance, but over a period of time, almost every district has got a COVID care center which is exclusively managed by Siddha system. See, இந்த இம்பாக்ட்லாம் இருக்கு. இதை டாக்குமெண்ட் பண்ணோம். இந்த மாதிரி ஒவ்வொரு இன்கமிஷன் பண்ணலாம். இட்ஸ் நாட் ஒன்லி a communicable disease, non-communicable disease or maternal child health. எல்லாத்துக்குமே there is a scope. When there is a challenge, we prove it, but we can continue to prove it. And second big problem now is your mental health. Physically தாண்டி almost 1 in 10 of us has got some anxiety, depression, everything is happening. Right now it's from the LKG student. See, everyone is stressed out. So the only way is that how we can incorporate this yoga, meditation, whatever it is, chinna a smaller way. You need not to practice for an hour, even 5 to 10 minutes of break. But namala nap edutona 10 nimasham vandila pogumbodhu thoonunave you become refreshed. The small intervention, if you are able to do it, particularly if you are able to do it in a child, definitely we can do it. Second big area is your next big area is your geriatric care. Old age has become common. The number of people which we need to support is becoming enormous. We call it elderly living alone. The proportion is increasing. Many people are socially, economically deprived. See, இவங்க எல்லாருக்கும் பண்ணனா the institutional care is not a solution. Hospital admit பண்ணி treat பண்றது economically it's not viable. ஏன்னா most of them will have a daily problem and 50% of them will be taking a polypharmacy, we call it. More than one drug or more than one or two ailments, they will be taking it. இவங்களுக்கு ட்ரீட்மெண்ட் ஒரே வழி வந்து we need to provide them a home-based care. And it need not be a physician-driven. See, the home-based care for a geriatric, which is a continuous care, it's possible only if you adopt a Siddha system. This should happen every day. This should be demedicalized. இது பண்ணணும்னா ஒரே வழி. That's what Sar was saying. அந்த காலத்துல எல்லா மருந்துகளும் நம்மள சுத்தி தான் இருந்தது. See, unfortunately, we couldn't document it or we couldn't go for an RCT, we lost the value. Now, at least in the Mari care வரும்போது, if you are able to provide them a basic support, this is a huge potency for the Siddha system to grow based on a home-based care. Now, otherwise, institutional care has got economically not viable. If you go to any reputed institution which is gives in a geriatric care now, you need to spend not less than a lakh in a month, which is beyond the reach of even upper middle class people. And finally, murdered children, see, all these issues, either it is maternal health or communicable disease or non-communicable disease, geriatric, mental health, இது எல்லாத்தையும் handle பண்ணனா we need to prepare our children. And children prepare பண்ணனா mostly it is the nutrition and your lifestyle modification. See, இது பண்றதுக்கு ஒரே வழி, we need to go in the way they want. See, அவங்களுக்கு fast food தான் வேணும்னா nothing wrong. இதை discourage பண்றதை விட how we can combine our technology, combine our nutrients into it. Still I remember South Asian countries la போனோம்னா there's a black pal cereals. சின்ன இவ்வளவு பெரிய கியூப் மாதிரி தான் இருக்கும். நீ புட்டு போட்டு நாளைக்கு ரெண்டு ஃப்ரூட்ஸையோ ரெண்டு இதையும் ஆட் பண்ணோம்னா நம்ம daily requirements we can fill it up. For most of our vitamins, minerals we can able to fill it up. It's easy to make, it matter of 2 to 3 minutes you can do it. But இந்த மாதிரி எல்லாமே இருக்குது, we need to do it. And finally, we are already co-located. Madam Varnana சொல்லிருக்கலாம். See, most of our PHs, there is an already co-located Siddha system is there or other Ayush systems are there. See, but the public wanted, there is a need. But sometimes we fail to create a demand. நம்ம ஏதோ ஒரு கார்னர்ல அப்படியே வந்தா வரணும் அந்த தேடி வரவங்களுக்கு மட்டும் கொடுக்கணும்ன்றதுனால we need to be little more proactive in saying that these are the benefits, how people are benefited. See, இப்போ நமக்கு அந்த antenatal periodல சில லேகிங்கள் கொடுக்குறோம், plus அந்த lactation improve பண்றதுக்கான நிறைய வசதிகளும் இருக்கு, but we need to promote. And the exercise which you teach during the antenatal period facilitate your delivery. Restoration following the delivery is very common, very simple. But இதெல்லாம் நம்ம proactive பண்ணணும். சரி, நம்ம வந்து okay யாராவது வந்தா சொல்லலாம்ன்றதை விட we need to take the system as pointed by sir. Unless the system grows, we cannot grow. We need to grow with the system, we'll do it. And second, again, let us not compete with each other. That is the role, there is for everyone. And how we can work together is the team. See, team up பண்றது தாண்டி இது ஒரே சிஸ்டம்ல நம்மளோட ultimate goal same தான். How we can collaborate with each other, how we can complement each other should be our goal. And product in வரும்போது, as you rightly said, RCT is needed. But even in allopathic medicine, the so-called bioavailability, it's a big challenge. See, the bioavailability with all the stringent manufacturing practice, challenge when we don't follow all this standardization, it won't be a big challenge. See, நமக்கு சிஸ்டம்ல கான்ஃபிடென்ட் போறதே என்னன்னா நம்ம இதுல வந்து ஒரு 500 மில்லிகிராம் இந்த பர்టిక్యులர் இன்கிரிடியன்ட் இருக்கும்னு நினைச்சிட்டு நான் சாப்பிடுறேன். See, somehow because of various reasons, if you are not standardizing, is that 500 கிராம் வந்து 200 கிராம் இருக்குன்னு வச்சுங்க, நீங்க சரியான மருந்து கொடுத்தாலும் you will not get the effect. See, ultimately என்ன ஆகும், patient will feel that this medicine is not working. See, this is how most of them will not get. ஏன்னா நம்ம எல்லாருமே by experience, the textbooks are there, but still when you go for the raw material, there is no standardization of the raw material. So the bioavailability ultimately ensure பண்ண வைக்கணும். And நாலு RCT பத்தாதுங்க சார். So the way we need to do RCT in each and every intervention. See, இந்த சயின்ஸ் மட்டும் தான் பப்ளிக் நம்புவாங்க. நம்மளோட நாலேஜ் நம்ம மட்டும் தான் ஒத்துக்கலாம். இங்கிலீஷ் மெடிசன் க்ரோ ஆனதுக்கு ஒரே காரணம் RCT தான். Particularly it's driven by Western field, but we also follow. But அந்த சிஸ்டம் இருக்கு. In fact, one of our institutions has already been working where we want to do it for an RCT with Siddha Medicine. DPH la we have our institute ethical committee. எந்த ஸ்டூடெண்ட் எந்த ஃபேக்கல்ட்டி வேணாலும் வாங்க,
let's do it together. There are so many ways we can do it. We are open for it. And another request, my understanding of Siddha Medicine, why it's grown is, it was available close to the community and it was an affordable cost. See, இந்த ரெண்டுன்னா it has reached. ஒவ்வொரு ஊர்லயும் வைத்தியம் இருப்பாங்க, பக்கத்துல இருக்க எடுத்துட்டு கொடுத்துட்டு இருப்பாங்க. So there is a belief. Now, the so-called wellness center which was promoted by Ayush, it's beyond the reach. இருக்கும்போது things will not grow. See, we need to reach the common man. And the common man க்கு ஒரே வழி affordability தான். So we need to go for a mass affordability closest to level possible. இதெல்லாம் இருந்ததுன்னா definitely we can do it. I once again thank you for the opportunity given. Thank you very much. Best wishes.